welcome to MedX 360. I'm Sherry Jampu, and on today's episode, we will have Genetri on the show, a company with a vision to see a world where no mother or baby dies during pregnancy, labor, or post-delivery. With us now is the founder, Mr. Arun Agarwal. Mr. Arun, tell us about Genetri and what inspired you to start the company.
Thank you, Sherry. Thank you for having me here. Thank you for this invitation. So I think very relevant question, what inspired me to start Genetri. So before I started Genetri, I have traveled down to more than 100 healthcare facility across the India and covered a lot of geography to understand why in this 21st century, we are in a 21st century and why mothers and babies are still dying while giving birth. And those numbers are too high if you look at the developing world. And that really opens up the mind, like technology can play an important role to actually prevent these lives and can be scaled up to actually save lives. And somehow a couple of dots also got connected with my childhood memory, where I come from a small town in one of the district in India. And that is where I used to hear a lot of stories around pregnancy, related complication, deaths, newborn deaths and all. And somehow the dots got connected and that really motivated me to work towards this social direction and started Genetri with a cause that we can save some lives while giving birth.
Definitely a very important cause. So what are the products that Genetri offers?
So Genetri trying to be a leader in the segment of pregnancy and newborn monitoring devices and application. But as of today, we have the products which are into fetal and maternal monitoring, which can be utilized in the phase of labor and in the phase of last trimester. So we have a product which can monitor fetal heart rate, contraction, maternal heart rate, which talks to the mobile application for automated interpretation, for remote monitoring, and can be utilized both at the hospital and home setting. Mother can also use at home, hospitals can use at home. So these are the existing products, but we'll be coming up with the more products soon.
That's really wonderful to hear. Now, you were on Shark Tank recently. Can you tell us about that experience and the outcome of that?
Overall, it was a great experience altogether. Ultimately, it gave us a lot of visibility across the whole globe. A lot of credibility has been generated. A lot of leads has been generated from hospital, channel partner, distributors. A lot of investors have reached out to us. So overall, ultimately, a startup needs some sort of a kick at certain point of time. So we got that sort of a kick ultimately after the Shark Tank. And yes, we're trying to maintain that sort of a momentum and kick.
I think that's very important and really good for your exposure as well, of course. Now, more than 2 million newborns are dying at birth yearly still. Now, how is your medical device looking to tackle that issue? And how many lives has Genetri actually saved so far?
Yeah, so this is the exact problem. What we validated is that a lot of mothers and newborns are dying or even getting the lifelong complication. So ultimately, what we found the gap is the gap in monitoring, a gap in critical vitals monitoring. Critical vitals like heart rate of the baby, fetal movement, the contraction, maternal heart rate. So what we found is if we can monitor the critical vitals at the right time, at the right place, and if based on that monitoring, if the right decision can be taken, we can literally save those mortality and morbidity. And that is something what we are working on. So that is how our product is solving that. So we are working on these variables which can monitor these critical vitals, and early alerts, early decision can be taken based on these monitoring.
Now, from what we understand, Genetri is a WHO verified portable device. Now, it monitors the heart rate and contractions. How does this differ from the traditional CTG machines?
Yeah, so if you look at the traditional CTG machines in the market since last 30, 40 years, those are like a big bulky machine and inbuilt display, inbuilt thermal printer. Data is not going anywhere. They're all not digital at all. And that is where we saw that I think the world is moving towards the whole digitalization side. But why why not the existing fetal monitor or existing product which are in the monitoring devices? So this is the one thing, like if a monitoring is happening at home or if a monitoring is happening at inside the labor ward, how a doctor can see the data remotely wherever she is, because doctor is not available always every time in the labor ward or at home. So one thing is solving the problem of digital. So I would definitely take this example, like world has moved from a button phone to a smartphone, and I think that is where this shift is also taking place in the medical device segment, where it is moving from a very traditional non-digital devices to the digital devices. So that is the one difference. And now, as soon as the product becomes digital, you can play a lot with the data. Ultimately, now the data is digital. You can play with the data in terms of providing the automated alerts. You can develop AI algorithms to provide early alerts or early intervention. All these things are possible, while these things are not possible with the traditional product. Remote monitoring is possible. Central monitoring is possible. Number two, on the hardware side, we have also come up with a new hardware where you just place the patch on an abdomen, and it will just be there until you deliver. You do not need to relocate the patch like the traditional. You have to keep relocating it. So we have taken the edge both on the hardware side, software side, AI ML side, and taking the whole fetal maternal monitoring to the highest level.
Absolutely. So my understanding is you just, place this portable device on the abdomen. So is it easier to use than your traditional machines for mothers, for doctors, for nurses?
Yeah, it is easier to use. You do not need to identify the fetus position. You just need to place it on the ones, and you do not need to keep relocating the patch until she delivers. So definitely it is easy to use, and it's a mobile application based. So the data is also visible remotely to the doctor, and now it's data is digital. So there is an automated interpretation is also happening on that graph.
I think that's very important for mothers to, keep track with what's going on during their pregnancy. Now, what costs is, the common man looking at when they want to invest in the product, and what costs are clinics and hospitals looking at when they want to invest in Genetri and have that within their facility?
So we have designed our product in such a way. Let's suppose a smaller hospital says, I just need your sensor. I can download your mobile application on my phone and I can use it. So for them, it just becomes the cost of a sensor. A bigger hospital says, okay, I want your product with the sensor and the inbuilt display and everything. And that is where the cost also goes up. So we have many variants starting from you can say $500 and goes up to $3,000, depending on the kind of a use case, kind of a variant, kind of a setting, and kind of a feature which a hospital needs it. So I think one solution does not fit all, and that is the challenge in the traditional product. So there is a different kind of a hospital setting. There is a different kind of a geography and population, even if it is going to be used for mother.
Absolutely. I completely agree with you there. Now, how many organizations or facilities have already introduced Genetri in India?
So we are almost in 250 plus hospitals. We have deployed the product. More than 60,000 mothers have been monitored so far. And more than 5,000 mothers have been referred or have been taken the early intervention based on our automated alerts.
That is very positive to hear. I'm happy to hear that. Now, in your opinion, what is the importance of artificial intelligence and portable devices in the healthcare industry?
I think that's the era. I would say that I think the portable devices and artificial intelligence based products in the medical, that era has come, and the era is moving towards it, because ultimately we have to save, making sure that product can reach out each and everywhere. So accessibility is there, and it should not be just dependent on the bulkiness of the product, or it's not able to reach out. Number two is that we should be able to save the time of the doctors in some way, and we should be able to save time of the nurses for early action, early decision, to actually take anything in terms of action or intervention. So that is how the AI ML is playing an important role in saving a lot of time, making more accurate decisions, and further impacting the life.
Absolutely. It's where the world is moving towards nowadays. Now, Mr. Arun Agarwal, what is next for Genetri? What's in your future plans?
We really want to expand into only the pregnancy and newborn monitoring domain, and that is where we are working towards it. So, if you look at this 1,000 days journey, starting from a mother become pregnant and the whole 9 month of phase, the labor, and then the baby becomes until 2 year old. So, this 1,000 days journey is very, very important, critical, and also a very beautiful journey. We just want to make sure that at every phase of the journey, whatever is the important critical vitals which can be monitored, and based on that, if something can be prevented or mortality or morbidity can be prevented, either at both hospital or home setting, that is where Janitri wants to come into picture and wants to be looking to be a market leader in this.
Thank you very much, Mr. Arun Agarwal. We'll leave it there for now. It's been a pleasure.
Thank you, Sherry, for those wonderful questions, and it was nice interacting with you.
Absolutely. Best of luck.